Hi, folks. It's a concerned Dr. Miskoff, and it is about 8:30 p.m. on October 2nd, 2020. It's been a while since we've done a vlog, over a month at least. Been very busy, but couldn't resist talking about our President Trump, Donald Trump, and his wife Melania, the first lady, contracting COVID-19, and then what are they getting as far as treatments? Donald Trump got admitted to Walter Reed Hospital, close to my heart, where my dad had trained. Oh my God, over 40, 50 years ago. So one of the best, if not, the best hospital in the world. He's getting obviously the best care. He's even getting care that others right now can't get unless they're in clinical trials. So let's go through some of that because I think it's very interesting. I think if you look back at the vlogs that we did even early on, the regimen that he's getting is exactly what we've talked about from a supplement end, even anticoagulation down to Pepsid. What he is getting that we didn't talk about, except in a segment on monoclonal antibodies, is a Regeneron product. I heard he has a connection, the CEO at Regeneron, and they gave him a pool of antibodies that are actually in clinical trial, and there's some early data on that. About 200 or so out of 1,000 or so that they're studying did show by giving this antibody pool that you can probably reduce the viral load, the amount of days that you have the virus, and some of the symptoms. We don't have mortality data yet. That study is not completed, but nonetheless, he did get it. I don't know if that was in clinical trial. I'm guessing it was just given to because he's the president. Again, he didn't get convalescent plasma. We talked about that in previous vlogs. Convalescent plasma obviously being giving those antibodies from people that have recovered from COVID-19. So a human blood product, if you will, the liquid form, plasma, and the data on that so far, it looks a little bit mixed, anecdotally a little bit mixed, but we are still giving it. There, does seem to be some benefit potentially. We'll know in the near future when more of that Mayo Clinic data gets organized and disseminated, published. There's already been some data to come out already, and emergency authorization for the use of plasma has occurred as well. What I found most interesting is that they're giving them a supplement cocktail. I think that's a good thing. Not all hospitals and physicians are doing that. There's no data on it, quote, quote, but there is older data with other viruses, upper respiratory and that type of stuff. Zinc, melatonin, vitamin D, the president's on all three of those. That was reported. I am still using zinc, melatonin, vitamin D, in addition to a couple other things that weren't mentioned. Zinc, thought to potentially reduce the replication of the virus. Melatonin as an anti-inflammatory. Some of that, those early vlogs we did on supplements included zinc, D, C, and others, selenium, etc. But right now it's reported that he's got the the antibody pool, zinc, melatonin. I'm assuming they're giving that at night, and vitamin D. I don't know how much. Some studies coming out showing that people with severe or lethal COVID had low vitamin D deficiencies. Not a big surprise. Large portion, if not most of us, are vitamin D deficient at some point during the year unless we take supplements or we have significant outdoor exposure. He's getting aspirin. I guess that's the equivalent of his anticoagulant or antiplatelet therapy. We're using Lovenox still. We're sort of, it's still in a way, we're winging it because there is no data yet to teach us or guide us exactly how to give it and how much to give, but everybody's pretty much getting prophylaxis with the exception of people with bleeding or low platelets. But if they clinically progress with COVID with the opacities or the pneumonia or oxygen levels will go up. I'm in the 500 to 1,000 range. Maybe we'll go from a sub Q40 daily to a twice a day. Not everybody's doing this the same, and if they get worse from there, maybe we go up to therapeutic dosing. That's kind of how it's being done. Personally, as I treat more and more cases, I think at some point we may see just that people go on therapeutic anticoagulation if they're admitted with COVID, treating it like an ischemic disease. And I think it'll be interesting to see some of the anticoagulation data, but as of now, it was reported he's on aspirin. So antibodies, not convalescent plasma, but these more synthetic type, these microproteins directly targeted at the spike protein antigen, and thought to be, in my opinion, a more cleaner way. Obviously, if you're giving plasma from multiple donors, We haven't mastered that necessarily for COVID. We haven't mastered anything for COVID, but it makes sense that it may end up being a safer, more directed or effective way of getting at that spike protein by designing it rather than just taking it from pooled donors. Famotidine or Pepsid, we talked about that in early vlogs at the Northwell system, using high-dose IV Pepsid based off of retrospective reviews from China. I think Harvard was involved in that. We did have a vlog on that previously. And the thought being that, or the look back looking at patients who came in as outpatients on famotidine, having I believe it was somewhere peri 15 or so percent reduction in mortality. Again, only observational. And those coming in on proton pump inhibitors having I think it was almost 25 or 35%, I'd have to look back at it, increased risk. Now, this isn't definitive. This isn't a placebo-controlled trial, those retrospectives, but it did lead to that. And I haven't heard anything from the Northwell system recently, but again, originally they were using and studying IV Pepsid at high doses. This wasn't a 20 milligram tablet you'd buy over the counter, but hundreds of milligrams given IV. So the president's getting antibodies, zinc, melatonin, vitamin D, aspirin, and Pepsid. That's all I know as of right now and what the public knows from what I've seen online. For good measure, I am using Pulmicort or budesonide, both outpatients who are still recovering or even earlier cases, and I'm using it in my hospitalized patients. Originally, we were told don't use steroids, don't use inhaled steroids. It's going to spread the COVID around the room in the nebulizer, and that may be partially true, but there are international clinical trials going on with inhaled steroids in both puffer forms and nebulization. And I personally, anecdotally, think it works, and the risk is very low. I mean, this is an FDA-approved asthma drug for kids and adults. So if Decadron was the only product shown so far or medication shown to save lives in COVID, the nebulized forms of inhaled steroids kind of make sense too. And you can use actuated nebs where the patient takes a breath and it delivers it. It's not just continuously going throughout the room. And there's also meter dose inhalers or puffers or dry powdered preps that some are using, and that's a way of getting around if you don't want to use the neb, because the delivery is very similar as far as what gets distally in the airways and the alveoli. So at any rate, I would say at the very least, consider the inhaled steroid for now. Remember, rinse with water. You don't want to get thrush. I didn't see anything about vitamin C. We know it was used in China, Italy, being studied also in, I believe, the New York system and elsewhere. You probably have to use pretty high doses of IV if you want to get anywhere. But at the same point, there's very little downside. Risk of kidney stones is minute. So, I think vitamin C probably will be found maybe to be better as a prophylaxis, or take it, before you catch the infection, but that's still to be determined. I also would add some other supplements, glutathione, which is a, super antioxidant, kind of works with vitamin C, bromelain, anti-inflammatory, been used in some for sarcoidosis, a lung condition that I do take care of as well. And that's from the pineapple root, and supposed to be good for you. So, I doubt he's going to get that, but inhaled corticosteroids I think would be a good idea, considering giving the president not just aspirin, but Lovenox or heparinized products, unfractionated if his D-dimer, we talked about D-dimers in previous vlogs, is elevated. So from my standpoint, I think he's pretty much getting the standard of care. I didn't hear Decadron. Personally, I would take that if I was him. I mean, if they're going all the way to giving, antibodies, I personally, if he had cough or any shortness of breath or desaturation, it would make sense. If he doesn't have any pulmonary symptoms of significance, then the monoclonal antibody for preventative without the Decadron, I guess, is what they're thinking if they haven't pulled the trigger yet on giving them dexamethasone or Decadron. Again, out of the original British study showing mortality benefit, and the only medication or therapy right now to show mortality benefit. Still the most inexpensive of all the medicines we've mentioned, pretty much, maybe except for the supplements. So obviously mixed views politically out there on our president, but as a human being, we wish him well. I do, at least, and want him to get better, and hopefully the country can get some stability here. This is just another thing to happen, unprecedented. To see a president get COVID is one thing, but so close to an election, just unbelievable and crazy. I think everybody probably feels similarly about that. Again, zinc, melatonin, vitamin D, aspirin, Pepcid, and this antibody pool from Regeneron. Very interesting. I would consider adding the pulmicort, the C, maybe glutathione and bromelain, and kicking up the anticoagulation. I wonder if self-proning is being told to the president to do. But again, it doesn't sound like he's progressed to moderate or severe disease, and they're trying to keep him in that mild zone or minimally symptomatic. And again, giving the antibody seems like a reasonable idea. There's going to be naysayers that say, hey, listen, this isn't peer-reviewed data. Even though the early data looks good, on the prelim on those 200 or so in the Regeneron study, how come the president's getting this without it being a peer-reviewed, fully published study? Or how come he isn't forced to go into the clinical trial like anybody else would be? I don't know. Maybe he did, but I believe those are going to be placebo-controlled. So that would mean he'd have a chance of not getting the product. I think it was just given to him as the president, which some would say, look, that's not exactly fair. Why can't we do that for everybody? And well, we know the answer. We're not getting this stuff until clinical trials are complete. He had a connection. He got his hands on it. He's taking the risk, but I think the risk is actually quite low when you look at other monoclonal antibodies that are out there, and it's not like this isn't at least started in clinical trials with some preliminary data. Everybody have a great night. We'll try and do more vlogs in the near future. Everybody stay well, and we'll see you soon. Take care.